Hello, everyone. This is Dr. Annalyn Schooley coming to you from South Florida, president of the Florida Family Therapy Alliance. And I am excited to be introducing tonight Rosalind Kwan, who is a PhD candidate at Capella University and is getting her dissertation. I am mentoring her, which is why I strong-armed her into presenting tonight, but she didn't resist me too much. So Rosalind is in California and does training of, I think, therapists, right? Do you train therapists, Rosalind? Um,
Yes, mainly.
and tonight she is speaking to us about what marriage and family therapists should know. And I'm very excited she's a marriage and family therapist because not all of my doc students are. So she is a fellow MFT in California, and is going to be talking about grief work with very, very small children. And that's grief with a G, not brief with a B. So grief work with very small children. So Rosalind, please tell us what else you think we should know about you, and please begin your presentation.
Sure. Let me actually see if I can do the sharing already. It looks like I can. Awesome.
And there it is. I do see it.
Great. Well, thank you everybody for having me, and thank you, Dr. Schooley, for that great introduction. My name is Rosalind Kwong. I'm a licensed marriage and family therapist here in California, and I'm also endorsed as an infant family mental health specialist and a reflective practice facilitator here in the state of California. I'm actually a part of an organization by the name of Sycamores, and also we have it's one of its program. It's a research and training institute called Hathaway Center for Excellence, and my role there at Sycamores is as an implementation specialist and also as an evidence-based practice trainer. And I'm very excited to be here talking a little bit about grief and loss. And I do have a very small private practice myself as well, working with children and adults with grief and loss issues mainly. Actually, I was thinking a little bit about my on my clients, and I'm like, oh yeah, actually, all of them do have some grief and loss issues that we are dealing with. This is a little bit about the agency. Sycamores began as an orphanage back in 1902, and then Hathaway actually began in 1919, providing family and children's services. And the two actually merged back in 2005. And then we went through a rebranding. So that's why we go by the name Sycamores now. But we also kept the Hathaway name for our Center of Excellence. We are one of the largest children's mental health providers here in Los Angeles County in California. And each year we touch the lives of about 18,000 individuals. And we're just extremely proud of the work that we do here. We have residential program, foster adoption agency, as well as a lot of community-based and school-based mental health services too. We also have a transitional living program too. And part of our work here too also involves with working with families. And of course, a lot of the families, we do work with very young children. So what we hope to achieve today by the end of our time today, it's our hope that you'll be able to describe the unique clinical needs of very young children that are bereaved with parental or caregivers deaths. And also we want to talk a little bit about the significance of the remaining caregivers or the surviving parent and having them as facilitators of the children's grief. And when we think about like this alliance here, I believe that everybody believes in the system and how the family is really important. And that's definitely one of the very important things we want to drive home today is what a role can be played by the caregiver and how they can be really considered to be an important facilitator of the children's grief. So why is this topic important? I think we all understand that that's definitely a part of life, right? So we know it's actually very, natural part of life, and all of us deal with death and losses too. And with death comes the loss of a parent or a caregiver, or even just a loved one for our children. And very often, when we think about losing a parent or a caregiver, the loss is actually a little bit even more significant because of the role that the parent or caregiver plays. Statistics actually tells us that about 3% of children experience a parental death before they turn 18. So, and even just in the year 2021, it's estimated that 1,900 children were bereaved each day with either the death of a sibling or a parent. So there are a lot of little ones who are experiencing losses, and among them, very young children. So not just children, but very young ones too. What we also know is that when there is a parental or caregiver death in childhood or even in adolescence, studies have found that that's connected to an increased risk of emotional and behavioral issues. And also, that's linked to lowered psychosocial development strength throughout the lifespan. So, what we're looking at is not only their current functioning as children, but we also thinking about how the death is impacting the trajectory of the development and also the lives of these young children. So it's really significant that we want to think about that. But also, why young children? Why are we talking about like these like really little ones? The reality is that, I mean, in my clinical experience, I've worked with very young children. But we also know when a very young child loses a parent, they are very much dependent on the caretaking of the adults, and they are significantly impacted. And the parent that could have provided life guidance for a child, the one that when a parent dies, then it really impacts the child in terms of not having someone there to be able to guide them throughout their lives. So not only are we thinking about having lost someone that's very special, but they have also lost the potential of having one that is able to establish that stability and permanence in their lives. So when we think about relationship permanence, losing a parent is actually really important and significant. And a young child's life is really significantly changed with the death of a parent or primary caregiver. And children usually feel very safe with routines, right? And with a loss, we know that there are going to be changes. And so with changes, we anticipate challenges. Studies actually that have been done that involve preschool children or very young children, it's actually very limited. And also, if they do exist, they are often a part of a broader age range. And so, when there are studies that included children that's younger than 6 or younger than 7, then they usually are a very small part of the investigated sample. So there's not a lot of studies historically done about the very young children's experience of grief and loss. Even though there is definitely an emerging sense of understanding that, we know young children have their own very specific developmental needs. And so, therefore, what we also want to figure out is what they require in terms of support. Because of their developmental needs, they require very tailored grief support in order to meet their developmental needs. And it may be interesting for us to think also that about how mental health clinicians are actually often perceiving themselves as lacking in experience and competencies. That's what some of the studies are finding, that some of the clinicians, even though they may have other clinical experience, they may end up feeling like they don't have the training or the experience in order to provide adequate grief support. So that's a very fascinating thing in my mind about how they are caught in a situation where they may not feel very comfortable doing this grief work, yet they have no choice when maybe someone that is coming to them for support actually experience a death. And so with a lot of parental deaths, we inevitably find ourselves as mental health clinicians in the place where we have to provide that support. Specifically, when we think about some of the losses during COVID as well. So there's definitely a lot of deaths. So why don't we start with a brief review of some terms. These are probably not new to you all, but just want to go over it really quickly. Now, bereavement, it's the life event or the experience of loss after having experienced a death. And the bereavement itself can be expressed in various forms of action. And so the mourning and also the grieving comes sort of like after the bereavement. So bereavement is the event itself that then brings a grief response. So when a loss is experienced, then an individual, whether an adult or a child, presents with what we call grief response, and that includes emotional, cognitive, and even social reactions. And grief interventions then are what we provide as clinicians, what we provide in response to the grief and grieving. By providing grief interventions, the target participants are when we think about what the target of treatment is definitely to help children grieve and also consolidate and reconcile what they are experiencing in the grief. Young children that we're focusing on in this presentation, it's actually going to be toddlers, preschoolers, and young school-age children. So we're looking at age 2 to about 7. And when we say that it's a parental death or a primary caregiver death, we're thinking about a primary caregiver, most often the parent, that's the person with the greatest responsibility of care and rearing of the child. And so keep in mind that, again, when you have someone that is mainly responsible for your care as a young child, losing that, it also means you're losing the stability that is created and maintained by the caregivers. And the loss of the primary caregiver can really be predicted to induce a sense of fear or stress response in young children. And in terms of mental health clinicians, we are looking at specifically those that are trained in providing mental health care. We acknowledge that there are many other adults in support in the ecological system of the child, including like teachers, school staff, but for this presentation, we're focusing specifically on mental health clinicians. So I'm very curious about what you know about grief and loss. I think that, if you look on the left side of this is very familiar to all of us. I think whenever we talk about grief and loss, a lot of times people do think about Kubler-Ross, right? So feel free to kind of let me know too what your understanding of grief is in the chat. But we know that, we always start with Kubler-Ross's 5 stages of dying. And again, I want to emphasize that, we talk about the experience as grief, but the work itself, when Kubler-Ross initially started talking about the stages, it was in his work on death and dying. So a lot of the grief has to do more with the death process itself, but it's very relevant to those of us that experience the loss after the death of somebody as well. But there are 5 stages. There's denial, anger, bargaining, depression, acceptance that I think all of us are very familiar with. Recently, actually, some other scholars have added to make 7 stages too. Sometimes they add a shock stage before the denial, and then also after the depression and before the acceptance. Sometimes we talk about like a testing stage where we're trying to kind of find meaning and negotiate. So there's a lot of value definitely in really understanding what a person may be going through in terms of like the stages, right, in the process of grieving. However, the issue with the concept that is stage-like is that it's more linear, right? So even if we present it in the way that it is in the picture, we're seeing the stages as more linear. And we know in reality, a lot of times grief is experienced more like what I'm adding to this picture, meaning that it's really not from one stage to the other and to the third. A lot of times we kind of have to go back to some previous stages in order to make sense of it. And we have to revisit an earlier stage, or sometimes we jump to a later stage as well. And we also know that everyone really experiences grief very differently. And so they go through these stages in different ways. And so using stages to theorize the mourning process is not always very effective, because it gives the false impression that you can actually move past each one of these stages. And so that's why in 1992, that's when Worden came up with what he called the task of grieving. So instead of stages, we started thinking about the tasks of grief. And based on this work in grief counseling and grief therapy, there are 4 tasks. You have to accept, process the grief, adjust, and then reinvest with a new reality. Now, there are still some limitations, but this is definitely an attempt in order to understand the process of grieving. So when we look at how to work with little children with grief, we'll definitely think a little bit about the task of mourning. In fact, we'll talk about, basing it on that. Now, Worden formulated the grieving process as these 4 tasks to be completed by the individual as active participant of their lives. One of the struggles with having a stage theory like Kubler-Ross is that the person that is going through the grief, a lot of times it's almost like, okay, you're being kind of shoved through the different stages. However, Worden really wanted to intentionally kind of empower the person that is going through these process of grief so that they are active participant in their life. And that's why they took an approach of more like, what are we going to have to achieve when you have experienced grief? So these tasks are designed to be conducive to the adaptation process so that an individual can adapt to the process of loss. Now, the model paints a picture of grief as a process, and we try to refrain from pathologizing what the person that is experiencing the grief. But the model is not without its limitations, because even though the 4 tasks are not meant to be in progression, a lot of times I think individuals may feel the pressure that, oh, I need to accomplish this, this, and that. And that becomes very discouraging when we think about how they're unable to do so in the order or, accomplish each of these tasks. So we have to acknowledge that also there is like cultural variation in how we experience, express, and practice grief. And so Worden actually continued to think about, how do we look at grief in a more individualized way? And so as he continued with his work, he ended up actually identifying what he called as mediators. So this is his way of trying to think about how there are individualized process of grief by identifying that there are mediators that are going to facilitate individuals in achieving those tasks. So these mediators can really help us think through how a person navigates the 4 tasks. And that kind of explains the reason why maybe some people are better able to accomplish a certain task because of some of these mediators that are in their lives. And those are things like, maybe how the relationship was with the person that died, or how connected they are. What about the quality of that relationship? We can also think a little bit about things like, what kind of emotional and social support that they're able to receive, including maybe family stressors or family support that they can have, maybe even present stressors that they are experiencing as well. We know that addressing these mediators for the accomplishment of the task will be really important. And so that is actually where the idea of the caregiver and what role they can play. It's really coming from, it's from these like mediators. And so we are thinking about how the caregivers can actually be very effective mediators in the process of the grief of the young children. Now, because we have chosen to actually focus on very young children, I want us to think a little bit about the fact that sometimes young children are often considered sort of like the forgotten grievers. I was actually just talking with a coworker yesterday about his father's death yesterday, and I asked about his children because I know he has very young children. His response to me, and of course, like we even a mental health organization, but he's actually not a clinician himself. He is like some of the operations, but his response to me was like, "She's 4. She doesn't really know what's going on." And I thought I paused and I thought a little bit about it, and I'm like, does she really not know what's going on? And what I found out also is that Grandpa actually is someone that the little girl spent quite a lot of time with on the weekends. And you know, as much as my coworker could, he would like make it a point to bring her daughter, his daughter, over to be with Grandpa and spend some time there. So that is just like a little story to let us know a lot of times how young children, because they're very young, there's the assumption that maybe they don't grieve or maybe they don't really understand. The truth is actually, yes, maybe if we think about cognitively, there are certain things that they don't understand. Um, but we also know that children do grieve, and or studies are showing us that they do. So let's think a little bit about what that grief looks like and what we mean when we say young children do grieve. A lot of times they do become forgotten or ignored or overlooked because of how we might mistakenly think that they don't understand. Now, theorists actually vary in their view of whether children have the capacity to understand death and to mourn. Um, Freud, for example, from 1960, actually suggested that young children did not have the ego capacities to accept the reality of the loss. Now, we know he also then, proposed that very young children cannot experience the pain of grief or even adjust to the absence of the deceased. Now, Bowlby in the next year actually thought it a little bit differently. He thought that infants as young as 6 months old actually experience mourning. And that, to me, it's very interesting. Now, keep in mind that I think what we are looking at from Bowlby's perspective, it's more the relationship, right? The attachment to that caregiver. Now, keep in mind that young children will react to events that are happening to us that are causing changes, right? So it doesn't matter how young they will actually respond and react to changes and to anything that's happening that create changes. In the first few years of life, children actually virtually have no concept of death because they are unable to really understand permanence, right? So a lot of times what that looks like when they've experienced a death is that they experience that as how their loved person or like that main attachment figure has disappeared. So they do experience the fact that that person has disappeared, that they don't see anymore. And so when faced with the death of a parent, children that are younger than 5, actually what we've found is that they can develop a precocious understanding of death. And preschoolers, they perceive it a lot of times as just an absent, right? Because they're not able to understand that it's irreversible. They're not able to understand that it's permanent. However, they actually do experience everything else that is going on, right? So young children that are including toddlers, they're actually able to keep the absent person in mind. That is, providing that they continue to have the support of a loving caregiver in their lives. So what a lot of studies are actually finding is that very young children, they're able to give reflective references to the absent caregivers. So they'll make comments about how not so much about contact related concerns, but it's more in their mind. It's almost like, okay, now they're not here. Now, how do I continue to remain to have like a continuing bond with them? Now, that's what studies have been finding. And when we really think about that, it's very meaningful for us to know that although children doesn't understand the permanence of death, and they may not appear like they would go through the regular stages, right? So they don't have to go through the stages of, I don't believe that, because to them, they don't have that capacity to really understand. Yet they can experience, however, that absence of the caregiver. Usually around age 5 is when children are able to gradually start developing a more mature understanding. That's when they're able to understand that, oh, that person is actually gone. They can even understand what it means when we say the body has stopped working. Now, in terms of what children remember, their memories, what we have found is that seems to be fragmented, meaning that it's very hard for them to be able to remember everything that they've done with the person that they have lost. However, those memories that they have are often centered around emotional scenes or rituals, which is what we know about children anyway, like young children, that rituals actually does create that memory in them. And so while they may not really realize what was happening or understand the full meaning of death, they still really can detect what is changing in their environment, right? And that is really important for us to understand that when we think about whether a child that's very young can grieve a death, it involves more than just a cognitive understanding of death. Because what they're experiencing is some real life experiences of the death, right? They are experiencing the caregiver changing. They are experiencing their lives changing. They're also experiencing a lot of what we call secondary adversities too. I think we use that term a lot when we're talking about trauma or traumatic grief, but whatever is sort of like a secondary loss to what they have lost from the initial parent or that primary caregiver is definitely very significant too. So when we think about that, we definitely want to think a little bit about what kind of support that they have. Now, it's very fascinating to me how not only my coworker that's not in the clinical field, but sometimes many clinicians still um, don't believe that there's a lot of work that can be done with very young children because caregivers may assume that they are actually not needing any support. So let's talk a little bit about um, what grief indicators may look like in very young children. Um, and I am just kind of curious if I were to ask you to rate yourself in terms of your understanding of how well you can recognize grief in young children. Let's rate it from maybe like a 0 to 5, 0 being, I don't really think I can tell, which I don't think anybody in here is going to rate themselves as a 0. Um, or like the 5 would be like, I can tell, I can always tell if someone is grieving, even if I'm very far away from them. So what would you rate yourself as? You can quickly put it either, yeah, with your fingers or in the chat, doesn't matter. Whichever way. Dr. Schooley is thinking a 2.
I'm not sure I could rate myself. I don't know
No?
where I would put it.
Yeah,
I've certainly
okay.
had more dealing with kids in war. I've had more than my share of kids in that respect, but I don't want to rate myself.
Yeah, I see. Thank you so much for letting us know. Yeah, there probably has been a lot of times when you have seen what that looks like. A lot of times when a child has a broken arm, you can see the cast, right? You can see, but how can we see grief? Even if we think about older children, sometimes it's very hard to see. In our coworkers, maybe sometimes they might have just experienced a death, and we may not even see that and know that. Now, for younger children, it's extremely challenging for us to think about what the indicators are. And depending on developmental level and cognitive capacity, there may be grief indicators that are like unexpected. For example, sometimes for children, even of all ages, difficulty to focus or concentrate has found to be a very significant grief indicator. And a lot of times, we may not see that as loss right away, or we may not able to pick that up as grief right away. Also, loss of productivity or loss of creativity, and that happens also across different age group too. Sometimes we do see behavior indicators can be very easily missed, especially by caregivers. And sometimes what is presenting as a tantrum, of course, can be read as, they're just being defiant or they're just being oppositional. Now, one young child that we've worked with, I also wanted to be able to say, I forgot my disclaimer a little bit, that, the introduction of any client story and also of my own clients and also my supervisees clients, I have intentionally try to change certain things or mix something around so that we can protect the privacy of the clients. So, but I will introduce different, scenarios or different stories. Now, one young child that we were working with would throw tantrums whenever mom would be at the hospital. And initially the mom's like, why can't she understand that I needed to be there with the grandma because grandma is sick and dying? And when we really understand a little bit more about that, could it be that it is part of that grief that the child is experiencing that is bringing that tantrum up? Now, one child that we were working with, now both of her parents actually died, and this child actually avoided all the rooms where the mom and dad would used to be, like the kitchen or the family room. That's where the parents used to hang out a lot. And this young child tries so hard to avoid all these rooms. And so all of a sudden, you find this little child really contained to her room. And so the caregivers are not understanding why, like she wouldn't come out to the kitchen, she wouldn't come out to the dining room. But later, the clinician was able to slowly figure out that, it was actually because all those rooms reminded her of her parents. And so there's a lot of grief reactions there. And of course, if there is a surviving parent, sometimes there's a lot of anxiety worrying about their surviving parent as well. And there are also physical indicators, little ones with tummy aches or stomach issues. After losing his grandma, one child that we were working with also presented with blinking, excessive blinking. And the medical provider could not figure out why, like they were trying to figure out, what was going on. And it wasn't medically caused, wasn't even allergies, but he was blinking a lot. And it was like actually the anxiety. And we know with very young children, a lot of times, it is manifested in a way that's more like a body reaction. Now, also, we know there's excessive tiredness, sometimes comes in waves, and the most common reaction can be sleep difficulties as well. So for a toddler, sometimes we expect regression, and because we know they cannot really process their grief using words, right? And it shows up in their development. And it can be said that they sometimes have a hard time getting back on schedule, and they may experience separation anxiety. And sometimes we observe them doing repetitive play, maybe playing the whole scene, the hospital scene, over and over and over again. Sometimes they may feel very scary and they want to stay at home. There's separation anxiety and with the surviving parent, or they may even really be worried about what is going on with their surviving parent. They may regress and wet their bed again, or some of their previously achieved milestones. because they are not able to understand that death is final, sometimes you will find them um, expecting that, yeah, tomorrow maybe I'll see that person again. And that's all very common. Um, and one of the challenges too is because they are unable to really understand death, sometimes the absence to them, they might, because of their magical thinking, attribute that to their own being. Now, I put a quote there that actually did come from a child that I was working with. She she actually thought that the death has something to do with her, and she's like she's very, very young, and she, because of her inability to really process what's going on, she ended up really attributing the death to her own fault. So they may believe that, death is a punishment. And remember, at this stage developmentally, it's all about them, right? So if something happens to a loved ones, it must be my fault. With any loss, there's always an increased need to control things in their lives. And because of that, we may see a lot of reactions like regression or aggression. And we may consider the child to be like, very inflexible, and they're unable to maybe before, when they had been flexible before, they might actually be at a point where they are not able to do a lot of things they used to do, partly because of their need in order to try to have everything under their control. Young children may also experience some fears and concerns related to daily life. Again, the parent and the caregiver is the one that provides most of the care. So they may be thinking about who's going to take me to school, and how do I who's going to brush my hair, who's going to help me with my homework, and all of that, all those secondary adversities, things that we need to think about. And let's think a little bit about maybe children that are a little bit older. So that's like what toddlers and preschoolers may look like when they are grieving. When they're a little bit younger, for our younger, like school-age children, when we think about the Piaget's operational stage of development, they are more likely to be able to understand that the person may not come back. But as much as we think that they are able to understand that, they still may not be able to express their feelings. So the feelings, what we describe often is that the feelings are actually a lot bigger than what their words can tell us, right? So what they're experiencing is actually a lot, and they're unable to process it, unable to tell us. And so because of that, a lot of times it then comes up in maybe behaviors. It comes in bodily reaction. It comes into how it's making me very uncomfortable, so I'm just going to change the subject. What we also know is that sometimes, because it is so challenging and so difficult, young children may experience the death of someone as very concrete, because their thinking is actually very concrete. And because of that, oh, okay, they died, right? So they may actually feel okay about it. But we can also expect that as they get older, they will start to want to make more meaning of what happens. So as they are going through their lives, they may actually want to talk about their loss again. So a lot of times, behaviors would be like, a lot of the grief will be manifesting as aggressive behaviors or nightmares. And definitely a lot of avoidance too at this age. So sometimes there's the avoidance of not wanting to talk about it. And so you have a very challenging age group to work with when there are moments when it is just very nonchalantly they will talk about it. I don't know if you've heard about how very young children actually will talk about death, and they will tell everybody that they see in sight. And I've actually had the kids in the grocery store come up to me and say, my grandpa died. And this is someone that I don't know. And just because we had that one moment of eye contact, this very young child decided to tell me that grandpa died. So the mom was extremely embarrassed about that, but it was actually a great way for us to be able to talk a little bit about how children actually sometimes will talk about the deaths because they don't really know what to do with it, right? They're trying to make meaning of it. And so they may just talk about it. But we also know on the other end of the spectrum, there are a lot of times when kids will avoid talking about it. And they will try to talk about it. And when they're unable to, guess what? They're not going to talk about it. So there's a lot of avoidance about that as well. And I also want to think a little bit about this. Now, the exciting part is that the DSM-5-TR now has prolonged grief disorder in as one of the diagnoses, and that's been very long. But even with that, the diagnosis in itself may not be able to really capture what a prolonged grief disorder may look like in a very young child. However, with the idea of prolonged grief disorder, we also know if grief and grief reactions are not addressed, then it's very likely that a child may actually then experience disrupted way of grieving, which then results in prolonged grief reactions. So there have been some studies, not specifically on young children, but on all children, about risk factors and protective factors. And I want to quickly, think a little bit about that because I think it's very relevant to the work that we do. When we think about why grief may be very challenging, it becomes even more of a risk factors, and a child becomes even more vulnerable when there are multiple layers of change. So let's say that, when you have a child that loses a parent, then we know that there is going to be a change in the relationship with the surviving parent. Without the support, we know that the child will experience this change as very abrupt, and it may be very challenging for them. There's also a change in the balance and family dynamics when that loss happens. And so the risk factors for a child being vulnerable for more maladaptive grief reactions is when family members respond to grief reactions in a way that's not helpful. Also, the reality, again, from the second adversities, there may be financial struggles. There may be limited capacity because the parent themselves is grieving as well. So when you think about that, the parenting is also a little bit different. Sometimes we have parents that may be a little bit more permissive because now that they feel like their child has to lose one of the parents, they may become very permissive, which may not be very helpful for children. And then sometimes too, a parent may not have the capacity in order to maintain some of the routine. And when you think about the fact that the parent actually may be experiencing a lot of psychological symptoms as well from the grief if they are unable to grieve in a way that it's helpful. So when you think about these risk factors, we highlight the role of the caregiver in the child's life in really achieving those tasks that we thought about. So on the flip side of this, we know factors would make a child more vulnerable in developing more like traumatic grief or maladaptive grief responses. But there are many factors that can be viewed as protective. If a child actually is experiencing that other people are supportive of their grief, that's actually a protective factors. If they are living in an environment that is stable and there is support, that's also very protective for them. Studies have also found that spiritual and also religious practice or rituals, and I'm wondering about, the fact that if there is something that's very constant and very routine for a child, how that can play a very important role as a protective factor. And of course, there is the protective role of the family, the way that the family is responding to the grief, and whether the parent can maintain a parenting quality that is helpful to the child. and the relationship with the surviving parent, as well as the fact that if the parent is able to reestablish some of the family routines beyond the loss, all of that becomes so important. And that highlights the fact that we want to make sure the caregiver is aware they play such an important role. So what are the treatment implications? Of course, like when we think about grief indicators being very sometimes difficult for us to be able to see, and then also that we sometimes are not able to pick that up, that a child may be experiencing that. We also know the risk factors and protective factors. When we do an assessment of a young child, it's very important for us to get a better understanding about the nature of their relationship with the deceased parent, because that will help us understand what kind of struggles they may be experiencing. We want to know the age and developmental level of the child, and also what existing resources they have. And of course, we want to know if there is any traumatic events or trauma exposure in the history that may actually help us understand a little bit more about how that young child will respond to a loss. Now, a few things to keep in mind when working with children with their grief. We know play, it's something that is very helpful. I think that this is something that is known to a lot of mental health clinicians, but it's very important to understand if grief work involves expressing feelings and also developing an understanding of the feelings, then play naturally becomes a very effective way of addressing that grief. Play, art, also storytelling will really be helpful for the child in order to attribute their own meaning to the experience. That helps them then be able to come up with a story about what has happened and what that means in their lives. So let's jump over and think a little bit about interventions really quickly. When we think about interventions, I want to present them in a way that follows Worden's task, right? So if we think about interventions in order to really support a child on their grief journey, we consider those to be 4 very important aspects to keep in mind. And we want to highlight that these 4 aspects don't go in a linear process. Just like how we said, like Worden's tasks are not meant to be a very linear process because it involves a lot of circling back. And that's the reason why I've chosen to present these 4 ideas like this, so that we see them as fluid, as being able to, as thinking about coming back. But if we were to start with our number 1 task in Worden, which is accepting the reality of loss, the way that I see it is how a loss can be very jarring, right? And grief can really bring on a stress response in a child. And so that can send someone to the brainstem where it becomes more of like a survival response. So it's very important to establish the safety for a very young child so that they can accept the absence of the parent and accept that loss. So it's helpful to establish that sense of safety. And we'll talk a little bit about what that can look like. But when the child is ready, we move up to task 2, about really dealing with some of the emotions. Task 2 involves processing the pain of the loss. And that is when we move up in our brain to a part where we are dealing with some of the emotions associated with the loss. Again, we may come back to establish safety and then deal with the emotions, but the child is more likely to be able to then deal with some of the emotions. If they are able to feel safe, and also when they have started making sense of some of their emotions, it would be very helpful for them to then, or they are then able to move to the upper part of their brain. Although for very young children, this is not a very elaborate process of making sense of what's happening. But in a very young child, they can start to realize what they have in their mind, what the story is about the person that has died. So we want to then move to the fourth task, which is establishing some kind of a routine for them to live with the loss beyond the loss. Now, we touched on the idea earlier on how a very young child is capable of really keeping the absent parent in mind and maintaining that continuing bond. And this is what this last task or this last step is all about. So if we look at the first task, which is to establish safety, one of the things that we want to highlight is how losses really create a sense of helplessness. And when we have lost somebody, we also feel like we've lost a sense of control. So it's often described, the grief experience, as unraveling. So therefore, it's important to ground all of us, and we often find the child in a very survival part of their responses, where they're just kind of doing fight or flight or freeze response, right? And so we need to anchor them to start with establishing a sense of safety. And what we do as clinicians is that we can be their interpretation partners for very young children so that they can then talk about the death. And from a developmental perspective, children, even though they're very young, can gradually, together with others, especially when they're younger, develop their ways of really drawing on what the social cultural environment is telling them about what is meaningful in that death. So as we allow them to talk about that, that's also a way for them to actually experience and start to make sense of what has happened. As providers, we must go ahead and listen to the children's story and take a very non-threatening approach in order to guide them toward a place where they can talk about it. Now, we can always start with giving permission about talking about it. And for some cases, we actually have to seek permission, maybe from a caregiver. I've worked with a very young child for the longest time. She would really not want to, almost like refuse to talk about the death. And we don't want to force her into talking about it, but we also know that she may actually need her caregiver in order to give that permission for them to talk about it. So what we ended up doing was to meet with the grandparent, because they've lost their parent, with the grandparent and them. And when the grandparent was able to sit in the room with her and say, we are here to see Miss Roslyn to talk about your mom's death. And I want you to know it's hard for me, and Grandma actually did say this, like it was hard for me to talk about it too, because I love your mommy very much. And so Grandma said, but I really think that it would be important for you to talk about it. And I have found that that actually was extremely helpful in giving that young child that permission in order to talk about it. It's important to reach out and let them know it's okay to talk about it. And just even asking, can we talk about this, will validate and let them know that it's important to you and you want to hear about it. There's definitely a lot of stigmas about discussing death. I think that even our society is moving away from the idea that it's not okay to talk about it. There's still a lot of historical background where folks are not very comfortable talking about death. So I want us to pause for a moment and for you to just kind of think a little bit about it. I think for Steve, actually, this may not be something that you experience, but a lot of times clinicians do feel uncomfortable explaining death and talking about death to a very young child. And that's understandable, right? So there may be discomfort surrounding, if I talk about it, will I remind them of the death, and will they then be really sad about it? What we have found is that if a clinician is able to deal with some of our discomfort, that actually helps the child know that, I think Roslyn's not going to fall apart when I start talking about the death of my mommy. talking about death with children, very important in a sense that we want to do it in a way that is developmentally appropriate. And for very young children, it needs to be very simple. And we can talk about death in a very honest way, but very simple way. A lot of times using short and simple explanations like death, it's when the body stops working. That will often be very helpful. So cognitively, a 3-year-old, 4-year-old, even 5-year-old sometimes are not able to fully understand that death is final. So they will ask, what does it mean? Like, are they coming back? And especially at holidays, sometimes it will be as if they have forgotten that that person has died. It's mainly because it's hard for them to understand that this is final. So it's important to communicate that the word death is not a bad word. One of my supervisees actually use this a lot, and she would say to the families that she's working with, and she would say, like, I just want you to know death is not a bad word, because I think a lot of times there's like hush hush about death. Let's not talk about it, especially when children seeing that the adults are not handling that word very well, they may actually shy away from using it. And remember, when explaining death, the task requires us to really talk in a way that helps them understand, right? So it can be as simple as death is when a person's body stops working and they can no longer breathe and think or feel anything. And even children as young as 5-year-olds would be able to understand that. It's important to know we try to avoid euphemisms. The reason being, children that are very young have very concrete thinking, right? So if we use words that are very symbolic, they may not really understand, right? So when we do explain that, try to stay away from things like, we lost grandpa. In a very young child's mind, they're going to think like, we lost him, let's go find him, right? Or, grandma's in a better place. Well, better place is here with me. What do you mean? She must not be very happy here with me. Well, what about, he is sleeping, daddy's sleeping peacefully. Well, I'm going to stay awake because I don't want to not wake up, right? If dad's sleeping peacefully. So I've also heard of a parent explaining to a child that, oh, now mommy's in your heart. And that was actually very scary to the child to think that, there's something that's now inside my body, that's inside me. So while it is okay to say things like that, but we also want to explain a little bit about the fact that, this is what we mean by saying that she's in your heart. It just means that we can always remember her, because it can be a very scary thought for little kids. There are a lot of books that can help with that. At the end of the presentation, we'll have one of the lists that would explain that. So I want to quickly then go through and talk about the fact that we want to help them deal with emotions. I think this is not new. When kids are very little, giving them coping strategies is very helpful for them to be involved in exploring their feelings and expressing their feelings. Giving them tools such as relaxation, mindfulness, or breathing can be very helpful. The idea is to make it fun, make it playful, make it artful. Then kids will then be able to think about it. Although sometimes they may not be able to tell us with words, they can show us with their play or with their art. Making sense of the laws. Now this one, because we won't do a lot of cognitive work here because they're a little bit younger. When we think about making sense of their laws, how we can support that, it may involve just understanding that, helping them understand how to get their needs met. So thinking a little bit about how things are different now, right? In this picture, I specifically select this because kids are actually very sensitive to their caregivers' responses. In fact, they may actually be more aware of their caregivers' feelings than their own. And so when we look at this particular picture, this child may be very concerned about their parent. Now, when we try to help a young child make sense of the loss, we want to help them know that they have needs that they can get met. We can work with the caregiver. Think a little bit about the fact with the death of a dad, maybe. Now, I don't have someone to bring me to soccer anymore, right? Or now that if that's the case, what can we do as clinicians to help support that? How do we problem solve with the family so that they can maintain some of the routines? How are they going to get their needs met? If mommy was the one that used to brush my hair, now is there someone else that can meet that needs? And of course, there are always difficult days, and we want to help a child prepare for that, especially when holidays are coming up. There's a lot of celebration. One of the hardest thing, and I'm so glad she is so insightful when I have a very young client that told me, I think I'm going to be very sad soon. And I asked, I wonder, what do you think it's coming up that's making you very sad? And she said, well, because on the calendar it says that like in May it's Mother's Day. And she said that, I think it's going to be hard because I don't have my mommy. And this client was probably like 6 years old when she said that, because at school they would have all kinds of celebration. So for us as clinicians, sometimes this involves really working with the teacher ahead of time, coming up with a plan about how to help the client deal with some of the difficult days. And of course, because of the continuing bond, we want to try to establish some ways for the child to remember. What we have found is that studies have found that children actually prefer to be a part of the rituals. I think sometimes, a lot of times, adults do feel like, well, they're so young, let's just leave them out of the rituals. But helping them to be a part of the rituals actually help them stay connected and help them with remembering, and they can envision what life is like without the person. So I have a few examples about some different types of interventions, but feel free to reach out to me, and I'm definitely more than willing to share some interventions that I like to use to help a child live with the loss after that. So now the important part I want to drive home is that caregivers definitely play a very important role as a key facilitator of their child's grief. With the caregiver's involvement, we can help them establish a family narrative or story to help with understanding that. It's also very important to integrate the family's beliefs surrounding death and loss. There may be some cultural specific things that we want to be aware of, as well as religious practices, customs, so that the child can be integrated into those rituals. Make sure when we are working with the caregivers that we help them use clear language, right? We don't want them to feel like, I don't know how to explain this. Dr. Schooley, I checked, but I was actually unable to put the flyer, some of the handouts yet in the chat, so we can figure it out a little bit later. And I do have a couple of handouts about how to explain death that may be very helpful for parents as well. And remember that we can help the family identify safety stars. And so these are the people in their lives that can be safe for the child. And the caregiver can actually play a very significant role. The entire family should be able to have a lot of support in order for them to be the best mediators and facilitators of the children's grief. So I want to pose this as sort of like our ending question for us. I want us to think about what it's like, right? When we do offer a child and say, can I help figure out what it's like to go on without your special person? Now, we want to emphasize the fact that grieving is a process. It's a very natural response, and we really should be encouraged to embrace that journey. So we want a child to embrace their grief journey. And so I just want to extend that invitation to you to be a part of their journey, to help them figure out how to go on without their special person. These are some additional resources. Once I figure out how to attack that, I'll put this PowerPoint in there as well. Sesame Street actually have a great section where they have videos and games about helping kids grieve. Our House is a great resource, and as well as the Dougie Center. The National Child Traumatic Stress Network also has a lot of grief resources as well. I've listed some books that I found to be extremely helpful. Eddie's Brave Journey is great because it's a book that talks about the elephant's journey after the death of someone he loves, and there are prompts inside that talks a little bit about the different parts of grief. And Invisible Strength is a book about maintaining that continuing bond with somebody. And I've listed a few other books too. So I have all the references here. And this is my contact information. Due to the COVID-19 pandemic, the rates of childhood bereavement has really increased. And so currently I'm actually doing research on children and young children. And actually it's on the clinician's experience of working with young children who have lost a parent or primary caregiver during COVID. So if you are interested in this study, please do contact me. Or if you yourself or someone else that you know may have this experience, this clinical experience of working with young children aged 2 to 7 that have lost a parent or a caregiver during COVID, I would really, really appreciate if you can please contact me so that we can have you be one of the participants possibly. So thank you.
Thank you so much, Rosalind. Thank you so very much. And Steve, I don't know if you have any questions or any thoughts at all?
Well, it's an absolutely extensive and great presentation and brought back a lot of memories for me. And all of it it's just right on, Rosalind. And thank you. I don't have any questions really. I think you cover the topic really well, and I really appreciate it.
Thank you so much, Steve. I appreciate it. I'm sure you've had a lot of experience working with this specifically, this topic. So I'm glad you were able to join us today.
Right. Well, so thank you very much, Rosalind. And I will be sharing this recording with others. And so I hope you have a lovely evening, Steve. Hope to see you at a future event.
Okay, so do I have contact information for you, Annalyn?
All right. So Dr. Schooley, I will email you. Okay.
Trying to take back control here so I can stop the recording.
Sure.
Ah, I got it.
Yeah. So I'll email you the presentation as well